My humble duty this morning is to request Your Excellency to address us and officially open this health media training. However, before I do so, allow me to make a few remarks. First of all, let me applaud Your Excellency for taking this initiative, which will go a long way in addressing to a challenge of infertility which has been neglected for years. Your Excellency, what you have done today shows that you have the welfare of the people of this country at the center of your heart. Let me also thank Your Excellency for finding time within your busy schedule to come and open this important media training. I am informed, Your Excellency, that yesterday you were also here performing such official duties, and thank you so much, Your Excellency. According to the Malawi Development Growth Strategy number 3, information and communication remain key enablers for socio-economic development. For people to participate, they require information. Development programs can only realize their full potential if knowledge is shared effectively and citizens are motivated with information to achieve success. It is out of this realization, Your Excellency, that the administration of His Excellency Professor Arthur Peter Mutharika enacted the Access to Information Law to facilitate people's access to information. Unless people themselves are the driving force to their own development, Your Excellency, no amount of investment or provision of inputs will bring about any lasting improvements in their living standards. Your Excellency, the media training you are about to open is one way of ensuring that the people of Malawi have access to information necessary for their livelihoods. Your Excellency, the training today is very unique in its nature because it is the first of its kind in our country. Previously, the media has received health-related training in areas of HIV and AIDS, tuberculosis, and malaria, among others, but not on infertility. The objective of this training is, therefore, to capacitate our media to contribute towards mindset and attitude change regarding issues of infertility. For a long time, Your Excellency, our society has stereotyped issues of infertility. The testimonies given by men and women during the launch yesterday are a clear indication that the problem is real. We heard affected women disclosing how they have been despised, rejected, or divorced on the grounds of infertility. On this note, Your Excellency, I would like to just say that I was just sharing with my friend Dingy that as I was watching the clips there, I was familiarizing myself because in my family, in my mother's family, there were 5 siblings. My mother had 4 siblings, 3 sisters and 2 brothers. The first 2 sisters, the firstborn and the secondborn, have never had a child. The first one is, today she's 91 years old. I'm taking care of her. The secondborn is 87 years old. They have never had children. And as I was growing up, you could sense the stereotyping that was going on in the village. Because one of the issues that was being said were that they were witches. There was something that happened for them not to have to bear children. So I was sharing with him that indeed I can familiarize myself with what was going on there. And this problem is real. And the fact that these things have not been reported for a long time, it has become a big problem. But today, this is an opportunity for members of the media to start now reporting these issues. It is therefore Your Excellency's expectation that you media professionals gathered here this morning will help address misconceptions about infertility by giving accurate information to the people through news, stories, and programs. Your Excellency, on our part, the Ministry of Information, Civic Education and Communications Technology will play its part to use the most modern technologies to produce and disseminate information, bring awareness, and sensitize the public. The information will be shared through diverse approaches, including the following: press conferences, press releases, posters, Malawi Mail newspaper, Bomalatu newspaper, documentaries, interactive film shows, road shows, online platforms, websites. Your Excellency, as research has shown, 90% of infertility cases are reversible with medical treatment. We, therefore, will take it upon ourselves as communicators to inform the public that infertility clinics are available in all central hospitals and some district hospitals to help those affected. The public needs to be well informed that a person cannot be judged as being infertile without medical proof. Let us all fight the stigma around perceived infertility. Your Excellency, before they leave this place, the media will be given media kits. These kits are to act as their reference materials so that errors do not arise in their news stories and programs. It is now my singular honor and privilege to request our guest of honor, the First Lady, Her Excellency Professor Gertrude Mutharika, to address us. Ladies and gentlemen, Her Excellency Professor Gertrude Mutharika, I thank you for your attention. Thank you.